Kari Rosenkranz from General Surgery, answering some questions. In terms of electives to prepare students for surgery, make sure that you do a sub-I. I would do one sub-I at Dartmouth, and I think it is really valuable if there's a geographic area that you're interested in to do a sub-I somewhere in that area. If you're going to do an away elective, you really have to do the elective having in mind that you're going to be the best possible medical student that you can be. I think places will always match the known over the unknown as long as you've done an excellent job and you're memorable in a good way. If you go on an away elective and you have an average performance, it really can't help and might actually hurt your application process. In terms of international rotations, if people are interested in global health, I would say that you have a lifetime to get involved in global health. If you have elective time, it's an interesting opportunity, and I think it would be great to do, but certainly nothing that is going to weaken your application if you haven't had a chance to do any work abroad. If you're having trouble deciding between two residencies, my honest advice is that you really want to make a decision before you start going through the application process. What I've found is that most people want to interview and want to match people into residencies who really want to do what they say they want to do, and if you're having some confusion making a decision, it might be worth taking some time off, doing extra electives to really decide so that you're the strongest possible applicant when you get into the interview process, and you can look across the table into the eyes of interviewers and tell them what you want to do and exactly why you want to do it, and have a clear sense of your career path. In competitive fields, I hate to say it, but the step scores do really matter. For better, for worse, no matter what you think about the test, it is one of the only ways to look across the country, and it's kind of the great equalizer. So step scores really do matter. So you really want to strive to do well on part 1, and if you've taken part 2 early, or if your part 1 scores aren't as high as you would like, I'd recommend take part 2 early and get a really high score and make sure that you get that submitted to your residency programs. In terms of transitioning from 3rd to 4th year, I think it's a really good time to start making that leap from being a medical student to really being the doctor. You're the person taking care of your patients. It's the best practice you're going to have before you go off with an MD behind your name, and you really want to act as though you are the intern. These are your patients. You want to know everything about the patient more than anybody on the team and really make them your own, and I think that will make the transition into internship, which is a pretty big jump, a lot easier for you. In terms of preparing for general surgery or for any of the surgical subspecialties, if you might be interested in a subspecialty, I would do electives early, whether it's urology or orthopedics. In the coming years, as third-year medical students, you will have an opportunity, actually as part of your surgical clerkship, to rotate through those subspecialties, which will really help in career planning. But as fourth years, when you're really looking to get strong letters of recommendations, typically medical students will rotate through the trauma service, often on the vascular service. But whichever service you do electives on as a fourth year, make sure that you have the strongest possible rotation, because that's really where you're going to garner letters of recommendation and strong words of encouragement for the residency application process.